Hello everyone, this is a preview on adolescent medicine. Substance and drug abuse. Tobacco use by adolescents can become a serious drug addiction. There is an increase in e-cigarette use in adolescents. Smoking is dangerous and can be a gateway to serious drug addiction. E-cigarette or vaping product associated lung injury, EVALI. EVALI is a lung injury caused by homemade solutions containing vitamin E acetate with or without tetrahydrocannabinol THC. EVALI is usually mistaken for pneumonia. Consider EVALI in patients with pneumonia who are not responding to oral antibiotic treatment with history of vaping or using e-cigarettes. Clinical presentation: persistent, difficult to treat cough, fever, dyspnea, GI symptoms. Investigations: white count will be elevated leukocytosis, elevated liver enzymes, elevated ESR and CRP. Chest X-ray may reveal diffuse, bilateral, ground glass infiltrates, basilar predominance, and subpleural sparing. Management: most cases of EVALI responded to systemic steroids, not to antibiotics. Assess adolescents' willingness to quit smoking at each clinical encounter. Motivational interviewing is the best. If at the stage of readiness for behavior change, help the adolescent to move forward. School and community support program is important. E-cigarettes counseling is important. Promote family strategies to avoid exposure to e-cigarettes. Alcohol use is common during adolescence, and the initiation at an early age is associated with alcohol-related problems and substance abuse. Also contributes to leading causes of adolescent death, for example, motor vehicle accidents and suicide. Also associated with psychiatric conditions, for example, anxiety and depression. Marijuana is the most common illicit drug used by adolescents, can have permanent negative effects on the developing adolescent brain. Be associated with poor school performance, euphoria, distortion of time perception, impaired peer and family relationships, mood changes, and impaired memory. Also can cause injected conjunctiva, tachycardia, and dry mouth. Also prolonged use can cause gynecomastia. Cannabinoid hyperemesis syndrome. This is very interesting. Consider this syndrome in an adolescent presenting to the ER multiple times with no clue why this adolescent continued to vomit. Cannabinoid hyperemesis syndrome causes recurrent severe nausea and vomiting associated with colic abdominal pain, always mistaken for acute abdomen. Vomiting that recurs in a cyclic pattern over months. History of regular cannabis use more than a year. Compulsive hot baths will relieve the symptoms. Negative workup for acute abdomen with no evidence of gallbladder or pancreatic inflammation. Labs may show just dehydration. Resolution of symptoms after stopping cannabis use. Management of cannabinoid hyperemesis syndrome. Cessation of cannabis is the best treatment. Abstinence. Dopamine antagonists such as 5 milligrams of haloperidol may completely resolve the symptoms. Benzodiazepine like lorazepam may improve the nausea and stop the vomiting. Aggressive fluid resuscitation in cases with severe vomiting and dehydration. Ondansetron usually doesn't work for this case. Amotivational syndrome, very common among adolescents because of chronic use of cannabis or marijuana. Cannabis chronic use cause cognitive deficit or impairment. Also, SRIs can cause the same. SSRIs consumption and dosage may cause apathy and diminish the motivation. Clinical presentation: lack of motivation, gradual detachment and disconnect from realities and responsibilities due to a loss of emotional reactivity, drives, and goals. Inability to focus on schoolwork or tasks due to lack of motivation. Lack of satisfaction with participating in educational activities. Management of amotivational syndrome: psychological support and cognitive therapy. Management of associated conditions such as depression and schizophrenia. Wean-off usage of cannabis or SSRIs and urine monitoring. Support groups. Opioid abuse can cause hypotonia, respiratory failure, hypotension, pinpoint pupil or miosis, coma, or even death. Management: airway, breathing, and circulation. IV naloxone. Gynecomastia occurs in 50% of boys between 10 and 16 years of age. It is common to be asymmetrical and can be tender. Most gynecomastia resolves spontaneously and requires reassurance. Management of gynecomastia. If is small or less than 4 cm, reassurance. If is large or similar to female breast, referral for endocrinological and surgical assessment.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.